We are going to insert an NG tube. So I have knocked on the door, I have introduced myself, I've explained to my patient what we will be doing without sugarcoating it. You want to really manage your patient's expectations with this one because it is not pleasant, and if they're not expecting it to not be pleasant, then they might fight against you when you're trying to put that tube down their throat. I'm going to provide for privacy and wash my hands. I've already raised the patient's bed to a comfortable working height, sat them up to a high Fowler's position, and placed my side rail down so I can easily access my patient. I'm going to check his armband. Can you state your name and date of birth, please? Okay, and I'm checking this against my order, making sure that I have an order to place this NG tube. I have all of my supplies here. So we have a towel, our suction tubing, a basin, the irrigation tray with syringe. We have our NG tube, lubricant, tape, a cup with a straw. The straw is very important. We have a safety pin and clean gloves. I have also pre-cut my tape. I have one piece that I will use to temporarily secure my tube when I get it in, and then my final tape here. All right. I'm going to set up my suction first. You have two settings, continuous and intermittent, and you push this one to each side to get to that. You also have the amount of suction right here. Generally, for an NG tube, you will want either low intermittent or low continuous. So that will be in the green, somewhere between 40 and 80 millimeters of mercury. From the wall suction, you're connected with this tube to the canister. We will then grab a suction tubing and connect it from the canister where it says patient. And this side will go to our patient once we are ready to insert our NG tube. We want to make sure that it works. By putting a finger over and feeling for the suction. And we will place this here so we have easy access to it when we are ready. Next, I will put on my clean gloves. And measure the length of the NG tube that I will need to insert. We will start at the tip of our patient's nose and go to the earlobe, and then down to the tip of the sternum, which is about right here. To remember that location, I'm going to go ahead and put my tape here. And loosely secure that. Next, I will get my patient ready. Going to drape a towel across their chest just in case we make any mess, and put a basin right here in their lap. I'm going to assess his nostrils. Take a peek in there, make sure that there's nothing obstructing my way into his nostrils. I'm going to ask him if either one is easier to breathe through, and that's the one we'll go through. Today we're going to use the left nostril. Right. I usually open these packs and place them right on top of this paper from our NG tube. You want to get a significant amount of lubricant on there to make it a little bit easier to go down for your patient. Have them hold on to this water cup if they can so they can drink. You can also have a friend here, a colleague, who can help them hold the water and drink it and just be there for moral support. Since this is a mannequin, I'm going to use a little bit of the silicone oil. Making sure that the end of this tube is inside the basin before you insert it. You're gonna have your patient keep their neck straight at first, put it in, and going along the bottom of the nasal floor toward the ear, you want to insert. Tell them to try to breathe normally. Get going. Skip this part. There we go. Once you have it at the back of the pharynx, have them tuck their chin down to their chest and start taking sips of water. And go ahead and insert it quickly, have them drink. Once you have hit the top of your tape, you can temporarily secure that. If your patient is lucid, you can also have them hold on to it to make sure that it's staying in the right position. Now you'll need to check placement. Depending on your hospital policy, there are several different ways to check, and your instructor will tell you how they would like you to check during your testing. Some possibilities are using your syringe to aspirate. You can connect it here, pull out the fluid. It should be yellow or green. You can also check the pH of that aspirated fluid, and you would expect it to be acidic. The best way to assess your placement is radiographic verification. So getting an x-ray to make sure that it's in the right location. Before you instill any fluids or medications into this tube, it needs to be verified through x-ray. Once I have my verification, I can remove this tape and use my permanent tape or my fixation device, whatever your hospital has. I make a little pair of pants with this tape by splitting it in the middle. The solid part goes on the nose, and then you twist around to secure the tube in place. And this tape goes the other way. All right, and then we will connect to suction. I already have my suction tubing here, so I will go ahead and attach that. Turning it on to whatever suction level was ordered. Once you have that, you will instill 10 to 20 milliliters of air into this blue tube. This tube is only for air, never fluids. Still. I will then clean my patient up, take off my gloves, wash my hands, and document the nostril that we used, the length of the tube, if it has measure markings, how my patient tolerated it, and if any fluids came out. I have knocked on my patient's door, entered the room, introduced myself, and explained to my patient that we will be irrigating his NG tube. I'm going to provide for privacy and wash my hands. I've already raised the bed and lowered the side rail, so I have easy access to my patient, and I'm saving my back. I'm going to identify my patient. Can you go ahead and tell me your name and date of birth? Good. I'm comparing that against his armband and checking my order to make sure that I have an order to irrigate my NG and how frequently it should be done. I have a basin, a towel to keep my patient's gown clean, an irrigation tray with a syringe, normal saline, and clean gloves. We'll go ahead and put those on. And first, I will assess placement depending on what my hospital's policy is. Put this basin right here on my patient's lap and the towel on top to keep his gown clean. We're going to go ahead and disconnect the NG tube from suction. You do not have to turn off the wall suction, and you really don't want to, because if there is drainage in this tube, the suction will help pull it into the canister and not spill on your patient's bed. So make sure there's nothing in here that can leak out. And this end of the NG tube can go ahead and rest in this basin. So if there's any fluid that's coming out, it will go in here and not your patient's bed. I'm going to disconnect this connector. And then I will check my normal saline. Looking at the expiration date. If it's already been opened, I'm making sure that it's been within 24 hours and that it's timed and dated. Go ahead and open that. You can lip it into a trash can per your hospital policy. Go ahead and pour about 50 milliliters into this canister. And then withdraw 30. Connect that here, and then push it in slowly. Ask your patient how they're feeling, if they're having any nausea. And then once that goes in, you want to pull out the same amount. All right, assess that that comes out easily. By pulling out the same amount of fluid, we don't have to document in our eyes and O's because the intake equals the output. We'll go ahead and put that in here. We can reconnect to suction. And then with a clean syringe, instill 10 to 20 milliliters of air into the air vent. I will clean up my patient, put the bed all the way down, the side rail up, and document what the gastric drainage looked like and that the tube was patent. And I will exit the room. I have knocked on my patient's door, introduced myself, explained to my patient that we are going to be removing his NG tube. I have provided privacy, washed my hands. Going to check his armband. Can you tell me your name and date of birth? Okay. And I am verifying this against my order, making sure that the surgeon or the physician is ready for this NG tube to come out. I'm also ensuring that my patient is ready for removal. So some things that you would expect to have happened for your patient to be ready are that they have bowel sounds, that they have passed gas and or stool, they shouldn't have any nausea, and we may have done a clamping trial where we remove the NG tube from suction for 6 to 12 hours and just watch the patient, making sure that they can tolerate being off of the suction. Sometimes we give them small amounts of clear liquids to see how they tolerate that before we pull the NG tube. If my patient has completed all that, I can go ahead and remove the tube. So I have clean gloves. I have a towel to keep my patient's linens clean. I have a basin. We need our irrigation tray with a syringe and saline, water, or air for this procedure. I will cover up my patient with the towel. And place my basin here. I've already turned off my suction. I'm going to unattach this from my patient's gown at this time. Placing this in the basin because you still might have some secretions that want to come out of the tube once you disconnect it. Going to get 15 milliliters of air. You can also use water or saline at this point, depending on your hospital's policy. Disconnect your tube from the suction tubing. And instill the 15 milliliters of air. This cleans out any gastric secretions from the tube so that when you pull it out, it's not dripping down your patient's throat. You want to loosen this here. And then you can either leave the syringe attached, or you can clamp the tube, or you can do both. And then you'll have your patient take a deep breath and hold it. And quickly pull out the tube, wrapping it around in your hand so that it doesn't fling and you have it all together. And then you can place it in your basin. Give your patient a tissue or something to clean their nose with. They might want to blow their nose. You can give them a warm wash rag so they can clean their face. Clean up my patient, ensure that they are feeling okay. I will remove all of my supplies, take off my gloves, wash my hands, document my procedure, and lower the patient's bed and put the side rail up.